Welcome back everybody to Lab 10, the Axial Skeleton. In this lab we're going to be looking at approximately 80 different bones. We do in fact break up the axial skeleton though into a couple different labs. Lab 10 is reserved predominantly for the vertebrae, ribs, sternum, and the hyoid bone we'll discuss. We will then reserve really the skull for another lab. But the skull is part of the axial skeleton. When we look at the axial skeleton, we're going to be looking at our vertebrae, and this is the vertebral column. There are 33 vertebrae that comprise the vertebral column, and then we're going to be looking at 12 pairs of ribs, which give you a total of 24 ribs, one sternal bone, or the sternum, also known as the breastbone, but in the lab we'll refer to it as the sternum. And then we have one hyoid bone. The hyoid bone is a floating bone. Can't really see it on this image here, but it's located underneath the jawbone, the mandible. And then we have a multiple sets of bones, some paired, some unpaired, in the skull that we'll discuss. Let's go ahead and take a look at the vertebral column to start with. When we look at the vertebral column, there are 5 regions that we need to discuss, and I'll start really superficial and work I'll start superior and work inferior with respect to these regions. Towards the head, we're going to be looking at the cervical region. There's 2 specific vertebrae that I want to point out here in the cervical region, and that is the atlas and axis. The cervical region is often denoted by C1 through C7 vertebrae. But for the purposes of our course, we're going to refer to C1 as the atlas and C2 as the axis, as this picture here denotes. Moving further down the vertebral column, we see the thoracic vertebral region. Thoracic vertebral region is made up of 12 different vertebrae that we'll discuss. And then just below the thoracic region, we have the lumbar region, which is made up of 5 vertebrae. And then below that we have our sacral region, or our sacrum, and in our sacral region we have 5 vertebrae that really in adults become fused. When do we see this fusing occur? Well, there is some variance here, but generally by the mid-20s all these bones should be fused. Now the last region is the coccyx region, and the coccyx is also a region of 3 fused vertebrae, once again, that we see fusion around, complete fusion around the mid-20s. Now in between the unfused vertebrae here, what you're going to be looking at are intervertebral discs, and these intervertebral discs are fibrocartilage discs that allow for really cushioning, support, and really to disperse a lot of impact. Hydration levels, interestingly, can affect the intervertebral discs. Generally, you will see increased risks of back injury or actually pain associated with the vertebral column, and it quite simply could be just dehydration. So, granted, there's could be a multitude of other things going on as well, but that's just one kind of unique importance of hydration levels amongst many others. We have this little memorization, I guess, mnemonic or system for looking at how many vertebrae lie within the cervical, thoracic, and lumbar vertebral regions. When you look at the cervical vertebrae, you're going to find that there are 7 cervical vertebrae. So the way we teach this is, think of eating breakfast at 7 in the morning. So eat breakfast at 7. When you look at the thoracic region, you have 12 vertebrae. You're going to eat lunch at noon, which is 12. And then you're going to have dinner at 5, which denotes 5 lumbar vertebrae. Fortunately, I don't have really anything for the sacral or coccyx at this point, but as you know, the sacral region has 5 fused vertebral bones, and the coccyx generally is comprised of 3. Now, when we look at the spinal curvature, we'll do just a little bit of really infant development here, and how we see what we call the primary curvature or a C-shaped curvature develop into an adult secondary curvature, and then subsequently the full S-shaped spinal curvature. All infants, when they're born, they have, as this picture is demonstrating, a C-shaped spinal column. And the reason for that is a multitude. One being they don't have the musculature to help support the head or the lower back and subsequently the lumbar region. So this creates a C shape in the spinal column. Now, as the child begins to hit a couple milestones, such as lifting their head during tummy time or tummy play, or as they begin to crawl, this will develop an actual secondary curvature. The secondary curvature will further develop as the infant begins to stand upright and then subsequently starts to walk. And that's going to develop really the lumbar region or the lumbar curvature. As that individual ages, we finally form what we all know as the S-shaped vertebral column. In the S-shaped vertebral column, we have 4 distinct curvatures: cervical curvature, the thoracic curvature, the lumbar curvature, and the pelvic curvature. Each one of these spinal curvatures actually have either a convex or concave shape, depending on what curvature we're looking at. So here, the cervical curvature, it has a convex shape, whereas the thoracic has a concave, the lumbar convex, and then sacral concave. And really what this creates is that, standard S shape, as we see. Now, what happens when we have abnormal curvatures? Well, it tends to be when an abnormal curvature exists, we deviate from the standard S shape. There are 3 different abnormal curvatures that we'll look at here. We'll look at them pretty broadly, but nevertheless it's interesting. The first one we'll look at is scoliosis, and then we'll take a look at kyphosis or kyphosis, and then lordosis. The first one I'll talk about here is scoliosis. And scoliosis is actually a result of lack of development of a vertebrae, or one or more really, in the cervical region. And what this does is it causes a deviation of the vertebral column from the midline of the body. So the woman here on the far left is actually demonstrating a scoliosis type syndrome. So as you can see, the thoracic region is sort of deviating off of the midline along with the lumbar region. And that tends to be a result of an abnormal cervical development. The next one here, kyphosis, is also referred to as hunchback. Really, kyphosis is caused by osteoporosis, which is a degeneration of the bone. The bone begins to break down. Now, what region do we generally see osteoporosis onset here, causing this type of hunchback? It's the thoracic vertebrae. So the woman in the middle there, you can see that although it's not demonstrating it at the cellular level, we can assume that she has some sort of osteoporotic event occurring, which is inducing this kyphosis. The next one we'll discuss is lordosis. Lordosis is actually kind of interesting. What we see here is a weakening of the core muscles, the abdominal muscles, and as a result, this actually affects that lumbar curvature. As you can see here, the lumbar vertebrae actually get really pulled in, if you will, because you can't actually maintain core strength. We see this quite frequently in women who are pregnant, individuals that could be obese, or at times individuals that have had multiple surgical sites around the abdominal muscles, and as a result cause mass muscle weakening, and then you see lordosis onset. Alright, now at this point what I want you guys to do is have you pause the actual AV lecture, and I want you to go back and sort of take a look at the regions of the vertebral column. I'd like you to sort of get in your head how many vertebrae are found within each region, and then I want you to go look at the formation of our C-shaped curvature, which we saw at really the infancy stage of life, and then the development of the S-shaped curvature, and then some unique abnormalities such as the scoliosis, kyphosis, and lordosis. So go ahead and pause, and after you've reviewed that, you can sort of continue listening. All right, now what we'll do is we'll continue on with the general structure of the vertebrae. So here I've just given you a sort of standardized vertebrae, and I want to point out some of the features that we'll be looking at. One of the first features that we'll see here is the body, and the body is really the more anterior region of the vertebral column, and every vertebrae, almost every vertebrae, you'll see this body on it. There is, quote-unquote, a hole that runs down through the vertebral column, and this hole is called the vertebral foramen. The vertebral foramen is actually an individual hole found only in one vertebrae, but when you begin to link all of the vertebrae together, this sets up something called the vertebral canal. And in that vertebral canal is the actual spinal cord. So this vertebral canal, or the individual vertebral foramen, actually allow a lot of protection and enclose the spinal cord, which, as we all know, is pretty important for movement. Next thing that we'll look at here is the vertebral arch. The vertebral arch is made up of a paralamina. It's a bilateral bony feature here, and two pedicles, once again bilateral. So you should be able to identify those on the vertebrae. And then we have a whole bunch of bony features that we'll discuss, or bony processes rather. The first one we'll look at is the spinous process. And if you go ahead and just take your hand and feel back of towards the back of your neck at the cervical region, you'll feel some bumps. What those bumps are actually the spinous processes of each of the vertebrae in the cervical region. We then have the transverse process. Once again, the transverse process is a bilateral process found on both sides of a vertebrae, and it's generally the site of attachment for connective tissues and some muscles. And then we're going to see the superior and inferior articular facets. The superior and articular facets are important in actually linking each of the vertebrae together. I think this next slide shows that. Yeah, in fact it does. This is good. So I want you to take a look here. Orient yourself, and I would like you to find the inferior articular facet located on thoracic vertebrae number 8. And I would like you to find the superior articular facet located on thoracic vertebrae number 9. When these link together, what you have is the inferior articular facets actually articulating or connecting with the superior articular facets of another vertebrae further down the vertebral column. So here, in this example, we're linking T8 to T9. If we were to look at T9 to T10, we'd have the inferior articular facet of T9 articulating with the superior articular facet of T10, and then subsequently down the vertebral column. Now here you're looking at a lateral view, and I would like to point out a couple different features. Notice, once again, this is different than the vertebral foramen or the vertebral canal, that collective canal where all the vertebrae are all linked together. There's something called the intervertebral foramina. The intervertebral foramina are actually formed by the vertebral notches of each adjacent vertebrae, meaning vertebrae on top, vertebrae below, and then we get these foramina, these small little holes here at this lateral view. Now what is so important about this is actually you can have spinal nerves that run out of these. And this is important for innervation of muscles, glands, organs, so forth. The next portion that we need to look at here are the intervertebral discs. The intervertebral discs, as I already stated, are actually designed to absorb shock and sort of disperse it. And once again, they're comprised of fibrocartilage. Something rather interesting is these intervertebral discs actually throughout the day essentially get squished. You got to remember that these have a lot of fluid in them, and as a result of us actually walking around as a bipedal individual, these get compressed. And this is just why in the morning we tend to be a little bit taller than where we are at night through the compressive forces of the vertebral column. Now, building on those intervertebral discs, we can actually talk about herniation. Herniation is a displacement of a tissue where it should normally exist in the body. So a herniated disc is referring to the intervertebral discs that have moved out of that space that's separating one vertebrae from another. So in general, a herniated disc is a result of the fibrocartilage itself bulging or actually breaking open and then subsequently pushing against the the spinal cord itself. This causes a multitude of injuries, not only pain, but we can actually see wear and tear of the spinal cord itself, and subsequently you could see complete loss if not treated in some cases. The more prone regions of herniation occur really in the lumbar region. So lower discs L4, L5, and S1 are the most prone for really herniation. Now that doesn't mean it doesn't occur elsewhere, but those are sites where we do see it predominantly. Now what you're looking at here in figure 2 is actually, the arrows are actually pointing at a herniation, and what you see in a light gray there is actually the spinal cord, and that's the herniated disc pressing against the spinal cord. There are a multitude of treatments for herniated discs. Some are more homeopathic or really home remedies, such as those inverted tables, so forth. But ultimately, many herniated discs, if continually progress, will need to go to surgical removal, and where you see now is a fusion. So, all right, now let's go ahead and walk ourselves through these cervical vertebrae. I am going to discuss cervical vertebrae C3 through C7 first, because there are some general features here that we'll see across really these vertebrae, and then I'll talk about the atlas and axis, or C1, C2. Here in the cervical region, a unique way to differentiate these vertebrae from the thoracic, lumbar, and so forth are the three foramina, the three holes. Now foramina means something actually runs through them. So here what we see is transverse foramen found on each side of the body, and the vertebral foramen, which, as you know, the spinal cord runs through. The transverse foramen, we actually have blood vessels that run through those. Now, another unique feature here is we actually see a bifid or a forked spinous process in cervical vertebrae C2 through C6. So if you look at the image there, take a look at the spinous process. Spinous process sort of has like a forked appearance, and that's indicative of it being a cervical vertebrae. The spinous process itself of the C7 vertebrae actually projects sharply in the posterior position. So if you were to feel the back of your neck, some individuals can actually feel this, where the spinous process, you'll feel all the bumps, and then all of a sudden one just drops very quickly. That's generally C7 if you know what you're feeling for. All right, C1 and C2, which we'll refer to as atlas and axis, actually are very important in supporting the skull and actually moving in the yes and no directions. So let's take a look at the atlas first. The atlas actually supports the skull, and it has these bilateral superior articular facets here. And these bilateral articular facets are actually concave in nature, so something sits really into them. And we'll learn what that feature is when we talk the skull. The atlas aids in really movement of the head in the sagittal plane. Remember the sagittal plane? Remember that term mid-sagittal, sort of the midline of the body? This is the nodding yes. Right? Now, I'll just mention it with you right now, but I'll point these out when we get to the skull itself. But there is something called the occipital condyles. The occipital condyles are these little bony, I guess bony features is a good way to describe it, that actually sit nicely in that concave superior articular facet on each side of the atlas here. And those allow the head to sit there and actually move in that yes fashion. Now C2, our axis, actually is held in place and connected to the atlas by actual ligaments. Okay? There's something called the odontoid process, or the dens, and that's what that arrow is pointing there. That's a really good identifying feature for knowing the difference between C1 and C2. And I have an image here on the next slide that should show you what the odontoid ligaments do in terms of actually helping hold it in place and then subsequent movement. Now, movement of the axis occurs in the transverse plane. So the transverse plane really here is we're shaking the head no. So left to right, whereas when you move the head in the yes direction, up and down. So here, what you're looking at, the transverse ligament, and it's helping hold that actual dens in place and articulate or connect the atlas and axis together. Now, you guys are going to need to know all these features with the atlas, so I'll just go through them briefly. We'll start here at the anterior tubercle. That's that little sphere-looking feature. There we have the anterior arch, those superior articular facets that I discussed, and those were bilateral. Once again, we're looking at cervical region, so we're going to have the transverse foramen on both sides, the posterior arch, and then the posterior tubercle. Now, with the axis, once again, there's some features you're going to need to know here, such as the dens, or the odontoid process, the superior articular facets, which articulate with the inferior articular facets of the atlas. Once again, transverse foramen, and then the transverse processes, inferior articular facets, and you have your lamina, the spinous process, the pedicles, and then the body. This is where we start seeing body formation. All right, before we go any further, what I want you all to do at this point is go ahead and pause the AV lecture. I'd like you all to go back and review the cervical vertebrae and the general structures of a vertebrae. Once you've done that, I suggest sort of coming back to the AV lecture and continuing on. All right, now let's take a look at the thoracic vertebrae. And as if you recall, we have 12 thoracic vertebrae. Here, what we do not have, though, is a transverse foramen. We don't see those transverse foramen like we saw in the cervical vertebrae. We definitely have a larger mass of the body of bone here. Okay? It's going to be bigger than the cervical region, but actually smaller than the lumbar, which we'll see in just a moment. Now, interestingly, the spinous process is actually pointed and angled at a downward fashion. And this is a result of where it's located in the body. For movement, there's many reasons for it, and for those of you going on to take kinesiology, I bet you they talk about this in some fashion. But we actually use this feature, this angled spinous process, to our advantage here. If you look at that image for a moment there, the lateral view, when you see that nice downward spinous process, it actually takes on the shape of a specific animal, and that's a giraffe. One of the things that you're going to need to be able to distinguish with each of these regions is what vertebrae came from what region. So in the cervical vertebrae, we pointed out those transverse foramen. That's a great identifying feature, knowing that it's cervical vertebrae. When we look at the thoracic vertebrae, you can take a look at this, and it looks like a giraffe, knowing that it came from the thoracic region. Just like we saw in really the general structure of really a vertebrae, we also see those same features here. So we have our superior articular facet the vertebral foramen, the inferior articular faucet, but we actually have a couple different faucets that we have yet to discuss, and those are called costal faucets. We have a superior costal faucet, an inferior costal faucet, and a transverse costal faucet. These three faucets, the costal faucets, actually articulate with the ribs, hence the thoracic vertebrae region. When we look at a rib in a moment, I will show you actually where the rib articulates with respect to each of these faucets. Okay? And here's just a little image of the giraffe, so hopefully you guys can pick that out at this point. All right. Moving down, we're now going to take a look at the lumbar region. The lumbar region is actually comprised of 5 vertebrae, and here we don't see a transverse foramen, and we are now lacking costal faucets. Why? We don't actually have ribs in the lumbar region. Once again, the body is larger than the cervical and the thoracic region, and that's a result of where a lot of the weight is being placed within our body, and that's the lumbar region. Here, where we see our spinous process, it's more horizontal in fashion rather than that downward angle that we saw in the thoracic region. And then we also see our superior articular faucets face a more medial plane versus thoracic region where we saw them in a more downward plane there. Now, if you take a look at the lumbar region, many people say the lumbar region actually looks like a moose. So once again, go to the lateral view and then take a look, and indeed it looks like a moose. And in lab, in the actual lab, your TA will hopefully walk you through each of these little mnemonics to memorize what what region this vertebrae came from, whether it be thoracic, lumbar, cervical, so forth. All right. So here is a really nice slide that I suggest everybody kind of take note at, maybe you create a flashcard, however you'd like to do it, that compares and contrasts the cervical, the thoracic, and the lumbar regions, and all the bony features that are associated with each. So I won't read these verbatim to you again, but know that this is a nice review slide that you can gather all the information that I've covered thus far. All right, now go ahead, pause, and go back, re-look at the cervical vertebrae, take a look at the thoracic vertebrae, and now the lumbar vertebrae as well, and be able to distinguish, the features found within each of them, and what region, if we were to give you just a vertebrae, it came from, based on, some of those little tricks that we discussed. All right, moving on down, we'll take a look at the sacrum. Sacrum is actually formed by 5 vertebrae, and as I said earlier in the lecture, we generally see fusion, complete fusion, by about mid-20s, so around the age of 26. Now, that's just a statistical average. It could be a year or two before, it could be a year or two after. It really just depends on the individual. Now, if you notice, the sacrum actually has this really nice wedge shape, and this wedge shape allows us to actually carry more weight. It just makes it stronger. Okay? A couple features here that we need to discuss. The ala. The ala it's a bilateral portion here, and it's kind of like that indented portion going up the wing, and we'll point that out to you in the lab as well. And the anterior sacral foramina. Those anterior sacral foramina are found on each side of the sacrum, meaning the left side, the right side here. When we flip this over to the posterior view, you'll see that we have a different name for it. Sorry, but that's just the way anatomy works. We also see in the anterior view transverse lines. The transverse lines are the fusion points where we saw fusion of each of the sacral vertebrae. Now here what you're looking at is the posterior view. Posterior view, I'm going to point out a couple features and then I'll discuss a few things here. First thing, you have the sacral canal. The sacral canal really is what runs through the sacrum, and then on the most inferior portion here of the sacral canal, you have the sacral hiatus. For you guys to actually see the sacral canal and the subsequent sacral hiatus, i.e. this hole that runs down the sacrum, you'll need to actually gather one of the real bones found in the lab. The plastic bones, the way they're casted and molded, actually don't have this actual canal running through it. On the sacrum, in this posterior view, you're also looking at the superior articular facet, which is going to articulate with the inferior articular facet of the lumbar 5 region. And as I stated a moment ago, we have these little holes that are found on the posterior surface. These are called the posterior sacral foramina, once again both on the left and right side. And then you have the articular surface that's going to articulate with the sacroiliac region of your hip. And this sets up something called the sacroiliac joint. And we'll discuss more of that when we get into joints, but this is an important joint. The sacrum, along with those bones, help set up what we all refer to as the os coxae, or the hip bones. And the last little portion of the vertebral column that we'll look at is the coccyx. Many of you may know this as the tailbone. And I actually was saying 3 vertebrae earlier, and really, once again, you do see some variance here. In this slide, we're going to call it 4 vertebrae, which is fine. Regardless here, what we're looking at is the fusion of vertebrae. 3, 4, it depends on the textbook and it depends on how you're taught. But what you have here are very small vertebrae that are actually going to be fused by really late 20s to very early 30s. Coccyx is important because it's also a site for muscle attachments. Many of those muscles could be coming from what they call the pelvic diaphragm. There's a couple different muscles that could attach there, so forth. All right, now at this point, go ahead and take a pause and go back, review your notes, make sure everything's really clean and understandable for the sacrum and the coccyx. Last couple bones that we need to discuss here. First one we'll look at is the hyoid bone. The hyoid bone is actually a floating bone, as I stated earlier, that's found really underneath the mandible. And the hyoid bone has a number of functions, but predominantly aids in swallowing and movement of the tongue, i.e. speech formation. So here, what you're looking at is the hyoid bone. I really encourage you all to take a look at this and some of the articulated models that we have in the lab, the big skeletons that are on the wheels, and you'll be able to find the hyoid bone on many of those. Now we'll go ahead and take a look at the thoracic cage. The thoracic cage collectively consists of the thoracic vertebrae, the sternum, and the ribs. And its overall function is really this protective cage that's going to protect all of the organs found within inside of it. So the lungs, the heart, so forth. Has all kinds of nice functions there. We have a series of ribs. As I stated before, we have 24 ribs, or 12 pairs. And these are referred to as the true and false ribs. The true ribs are pairs 1 through 7. And they attach to the sternum directly with hyaline cartilage. Your false ribs are pairs 8 through 12. And then you have something called your floating ribs. Your floating ribs are pairs 11 and 12. These are floating and they are not attached to the sternum at all. So when you go back and look at the false ribs, notice that those false ribs, the actual connective tissue, the hyaline cartilage, sort of connects together and then goes to the sternum, whereas your true ribs, each rib has its own set of hyaline cartilage. And here's an interesting little tidbit. It used to be that many women would have a surgical procedure done to actually remove a pair of the floating ribs, the ribs that are not connected to hyaline cartilage. What this would do would actually cause this hourglass shape, much more exaggerated, but this was a cosmetic surgery to really look better. The There could be complications from it. You definitely don't see it as readily anymore. But once again, this is something where many people had done for cosmetic surgeries. Let's go ahead and take a look at some of the bones and their associated features with respect to the thoracic cage. First one we're going to look at is the rib. In lab, it's going to be really important for you to understand how to determine the left and right side of a rib. And your TAs really, or your instructors, should be going through this with you. But we also have uploaded some really nice review exercises on your course shell. So go ahead and take a look at that as well. But there are a couple features that I want to point out here. First, you're going to have something called the proximal head, and then you're going to have the neck, and then something called the tubercle. The tubercle and the head are sort of separated by this neck. The neck's meaning the neck's in the middle of it. Okay? We then also have this costal groove. It's this little groove that runs along the rib there. Now, as we stated earlier, we had a superior and inferior, and then a lateral costal facet, or transverse costal facet. Complete mind blank there. That actually that are found on the thoracic vertebrae that are going to articulate with the tubercle and some features of the rib. So I have here articulation. The tubercle with the transverse costal facet of the thoracic vertebrae, and that's what it's showing, and the head of the rib articulates with the superior and inferior costal facets of the thoracic vertebrae. So that's what it's showing you there, is the articulation points of the ribs. Now, some other features that we didn't discuss here. We've talked about the head, the neck, the tubercle, and the costal groove. We have what we call the sternal end. There is then the shaft and then the angle of the rib that you'll also need to know. So be able to identify all those features as well. Now here, it's just a little example of numbering rib articulations. So go ahead and just look at the bottom of the slide. Rib 6. Rib 6, number 1, articulates with the inferior costal facet of thoracic vertebrae number 5. Rib 6 articulates with the superior costal facet of T6, and then number 3 articulates with the transverse costal facet of T6. So here, the inferior costal facets, you're looking at the actual thoracic vertebrae that's further up, whereas the superior and the transverse costal facets, you're looking at the vertebrae that's below. Okay? The picture on this image here actually does a nice job of that. So take a look at rib 6 there. Rib 6, once again, articulating with that inferior costal facet of T5, and then the superior and superior articular facet of rib 6, the inferior articular facet of rib 6. So it just goes through that portion. All right, continuing on with the sternum. The sternum itself is actually comprised of 3 bones. These bones are actually fused together. The bones themselves are the manubrium, the body, and the xiphoid process. Now, the xiphoid process, for those of you that have had some first responder training, whether it be Red Cross, Ellis, just really depends, American Heart, the xiphoid process can actually be broken off or easily fractured, and a result can actually puncture the liver during some cardiopulmonary resuscitation CPR, which as a result can further damage the individual. So that's why they always teach you to palpate the xiphoid and then go, depending on who's training you, 2 to 3 fingers above, so you're more on the body during your chest compressions. Now, there's a couple key features that we need to discuss in these 3 bones. The first is called the clavicular notch. Clavicular notch is where the clavicle, or the collarbone, which hopefully you guys are all calling the clavicle now, actually articulates with the manubrium. Then you have the suprasternal notch. The suprasternal notch, if you can actually palpate it, just go up to the manubrium. That little protrusion, or that little, I guess, groove there would be the suprasternal notch. You then have the sternal angle. The sternal angle, once again, it's lateral, bilateral. We see the manubrium actually fusing with the body, and it's showing you the sternal angle there, and it's found both on the left and right side. And the costal notches. The costal notches are the notches where you see the hyaline cartilage articulate with the body and then subsequently the ribs. And that's the end of this AV lecture. Make sure you guys, actually go back and study many of this. There was a lot that we threw at you, a lot of bony features, the regions, the articulation surfaces. So there's a lot to get down here. Just make sure you're practicing with this, and feel free to ask any of us if you have questions. Thanks a lot.